Good afternoon, everybody. Good morning, good night, good evening, good
Depending on where you are.
summer or winter or beginning of winter
Harmattan.
or harmattan. So today we're having a guest, special guest of honor, Dr. Marietta Ekeng. So can you introduce yourself briefly?
Yeah, like she said, my name is Dr. Marietta Ekeng. I'm a medical doctor and a health promotion.
Alright, so thank you, Dr. Marietta, for gracing this interview.
Thank you for having me.
Yeah, so we'll be talking about sexually transmitted diseases. Not so much stuff, but at least key points that are useful for everybody should know, and trust me, it's going to be worth it. So, what are sexually transmitted diseases, Dr. Marietta?
So, like the name implies, they are diseases that are transmitted primarily through sex. Okay, they are either caused by viruses, bacteria, or parasites.
Okay. So, what are apart from sex, are there other ways that people can contract them?
Yes, so some sexually transmitted diseases have other modes of transmission. For instance, if I were to go to the viruses like HIV, outside of being transmitted through sex, you can also have it through mother to child transmission or through blood products. Same thing with hepatitis B, you can have that also transmitted through the
Okay. Yeah. So, what are examples? Can you just give us a
Okay.
rundown of examples?
There are lots of sexually transmitted diseases, but high on the list is HIV. Yes, so HIV, hepatitis B, syphilis, gonorrhea, chlamydia. There are several popular ones. These are just a few of them. We have human papillomavirus too, that causes cervical cancer. Things like that.
Right. So, what are the myths? Myths that surround sexually transmitted disease?
Okay, so some people personally just feel they're immune to all sexually transmitted disease. Yes, so their blood is correct, so they can never have anything. Yes, some people just believe that they are somehow supernaturally protected, and so they cannot get any sexually transmitted disease. Some people think that douching, like after sex, can clear off sexually transmitted diseases. Some people think that it's a particular antibiotic that works for all sexually transmitted. So once they take it, you're good to go. Those are some of the myths associated with it. Yeah.
So, but how can people prevent contracting?
Okay, so from the name sexually transmitted diseases, now there are different. First off, you can abstain, but if you do have sex, it's good to be protected, especially if you have more than one partner. So you don't know where this other person has been. So how do you protect yourself? And that's where barrier methods come in. That's the use of condoms. There are male condoms, there are female condoms. The female condoms are not so popular. Women don't use that much. But the one that everybody knows are the male condoms, and they're pretty cheap. You can get one for 15 naira. There are different brands and things like that. So those are particular ways to prevent it. Then some of them, like something like hepatitis B now, you can be vaccinated for it. Yeah. So children now are immunized upwards. Adults too can get 3 consecutive vaccines to help to prevent, and you can get a booster dose afterwards. Human papillomavirus too, you can also get vaccinated for it. I don't think that's so popular in Nigeria, but it's actually available from 11 years of age. They offer it to girls.
Well, it's like they also offer it to boys.
Yes, they also offer it. But in Nigeria in particular, I know that it's not very common, but you can offer it to both boys and girls from the age of 11. Yes.
So, how about treatment of sexually transmitted?
Okay. So before I talk about treatment, it's always good to know what kind of sexually transmitted disease that you have. And that's where I would say is important the most, making that diagnosis in particular. Because some people have symptoms, like for certain, like syphilis, and also some people have like ulcers, or herpes, they have like warts and ulcers around their genital area. Some men complain of burning pain, depending on what kind of sexually transmitted disease that they have. So when you have those symptoms, the first thing to do is to go to the hospital so that you can get tested, so that we know what kind of sexually transmitted disease you have. Okay? For things like HIV, it doesn't show on the face. So you don't have any symptoms for the longest time, so it's going into full-blown AIDS. So you get tested frequently, at least when you're doing your annual medical checkup. You should also have a HIV test done, hepatitis B test done. That's if you've not had the vaccine and all that. Like even syphilis, chlamydia, gonorrhea, all of those things can be tested for, and their treatments are all different. Some, like HIV, requires use of, it's not curable, but you can modify its infection in your body. So you have antivirals for HIV. Then for other bacterial things like syphilis, you can actually give antibiotics for it. Things like gonorrhea and things like that, you can actually treat those ones.
Okay, so there are some that are like HIV you cannot treat.
No, you can manage. Yes, you can manage it. You can't cure it.
You can't cure it.
Yes, but you can manage it.
But for syphilis, gonorrhea,
and
some
all,
of them
yes,
you can treat.
Yeah.
But for I used to hear that for things like hepatitis B, once you have it, you already have it. Okay. So is it true?
Yeah. So that's why there's a vaccine available to avoid that in the first place. Okay, so yes, for hepatitis B, once you have it, you can be treated, but you have it over the course of time. The way the treatment goes is to help to prevent you from transmitting to other people. So you can still have a normal life even after treatment. It's just that if they test your blood, they will see the hepatitis B.
But is there any chance that person will not die?
Yes, if it's caught early. Yes, so you start your treatment early and then you can have a normal life. Same thing with HIV. If it's caught early, you can start your treatment and you have a normal life. You have your kids, and you don't transmit it to them.
Okay, so how about you said we were talking about when we're talking about diagnosis, we're talking about those that have maybe burning sensation, but there are some people that they have multiple partners,
yes,
and they don't have any symptoms. I'm fine. How are they going to now, or is it that once you just have multiple partners, you should from time to time go for checkup?
Yes, I would advise that. Okay, so if you know that you're going to have more than one partner, the wise thing is to check yourself frequently. Every 1 to 3 months, you should have yourself checked up. Because especially if you're having unprotected sex, and then something like HIV, there's a window period, maybe 3 months. You might have done the test and then you're in the window period. So it's until after 3 months that you can actually make that diagnosis. So that's why it's advised that you frequently check yourself. Yeah.
So when you have done your checkup and then you are tested to positive to any of these diseases, how long does the treatment last? And is it because you hear some people they go to this community pharmacy, they get treated 1 or 2 months again and still having the same, or they even do maybe like a culture, and all the organisms that all the antibiotics are sensitive, they've treated and they're still having symptoms.
Okay, so there are different factors that play into that, right?
Okay.
So different sexually transmitted diseases, different duration of treatment. For HIV, you're going to be taking your medications for life. Do you get?
Yeah.
Yes, but for things like syphilis, depending, you can have just 3 shots or 2 doses of the antibiotic and you're fine. For things like gonorrhea, sometimes they want to treat it alongside other things like chlamydia and all that. So they'll give you either an iron medication with tablets that will take a while, maybe like a week, and your medication and your treatment. So you can't say this is the duration for all treatments for sexually transmitted. But the thing I always advise patients is, after you've been treated, come back to see. Because it's called continuity of care. You have to be sure that you've actually treated the process. So sometimes there are specific tests that you can do to see whether the antigen is still there or the antibody is still there and all that. So it will give you an idea of or you've treated this, or this person had a previous infection, or currently is not infected, things like that.
Okay. So briefly, how about herbs? We have people that use
Okay.
there's this herb, there's this concoction, this elixir that I'm using, and once I take it,
Yeah,
nothing.
good to go.
So what do you think?
Okay, so I primarily don't dispute people's personal beliefs on things like that.
Okay.
But I have realized that if you cannot prove that what you're doing is working, right? It's supposed to be evidence-based. If your concoctions or your potions are not working, you cannot replicate that same treatment in someone else or in a majority of people, because medications, that's how they are tested and they are valid. You should be able to replicate that same thing in a high population. Yes. So if you are saying, oh no, this is the final treatment, and then
The next person doesn't
work for them, we have to question what you believe in at that point. So you can say, okay, yes, you believe this works for you, but if we see that your symptoms are not going, really, it's not working for you.
And then you get some people, they will say they are taking herbs, so using it to like deceive other people, but
Yeah.
maybe subtly or
Yeah,
they're
and
taking
that's
medication or
very
they're going to
common.
see the doctor.
Please be aware. Yeah, because I've even heard where people put antibiotics into those concoctions. So they might be the right antibiotics and gives them some form of relief at that point. So they just feel, oh, their concoction is great.
Yeah.
Do you
Or
get?
they're
So
taking
please,
it.
many people are just fraudsters. Many of them are just fraudsters.
Okay.
Yeah.
Yeah. So lastly, non-treatment or poor treatment, what's the long-term impact? And then many times people just, when they are talking about STIs, they just focus on men,
Okay.
and there's really not much focus on the women. So those two things, what can you say about them?
Okay, so sexually transmitted diseases, depending on what's the causes, so the effect is different. For instance, HIV, if you don't pick it up, it goes into full-blown AIDS, right? And then you have all those symptoms, and people eventually die. Same thing with hepatitis. Then HPV can progress to become a cancer. Okay, things like that. Other bacterial ones like gonorrhea, chlamydia, syphilis, all those ones, it tends to affect the reproductive tract in people. So those are the longer term complications that you see.
So it can
So-
affect fertility.
Yes, exactly. So many people have fertility issues now that they don't necessarily, like if they think they've had all those STI symptoms in the past,
They are not treated.
they were not treated. Because it can cause tubal blockages in women and things like that.
So, but do you think it affects women just as equal as it affects men?
So I think it depends on what the cause is. Yes. But when it comes to fertility in particular, fertility, that's a different discussion
I think
altogether.
I need to bring somebody to talk about fertility.
Yeah.
Yeah. Alright. Thank you so much, Dr. Marita, for having this health chat with us. We'll still be reaching out to you. Reaching out to you. So, thank you so much.